Hello and welcome to our latest discussion in the new Syrian Perspectives series hosted by the Center for Global Policy. My name is Faisal Aitani, and our moderator today is CGP Fellow Bassam Barabandi. You have our guests' biographies. I will be very brief before I hand over to Bassam. Everybody here brings a rich personal experience and expertise to the conversation on the Syrian health situation. Fortunately, I believe Dr. Muhammad Salim was supposed to join us, but the internet was cut off, perhaps deliberately where he is right now. So we've lost him for the time being. Dr. Khaldoun Al-Assad is an OBGYN physician who's practiced in Quneitra and in the Department of Primary Care and Communicable and Chronic Diseases. Dr. Assad joined UNICEF, serving across the country during the conflict before leading the Aleppo Directorate of the United Nations Population Fund. We also are fortunate to have Dr. Munzir Khalil. He's the general manager at Idlib Health Directorate and someone who's managed a number of hospitals throughout the conflict. He's been deeply involved in building local councils and documenting the use of chemical weapons in Khan Sheikhoun and Sarakid, rural Idlib province. And last but not least, someone who joined us was only able to confirm recently, Roger Lou Phillips, who is the legal director at the Syrian Justice and Accountability Center. Previously, Mr. Phillips served as the UN legal officer at the Khmer Rouge Tribunal and the International Criminal Tribunal for Rwanda. The Syrian Justice and Accountability Center has been doing some interesting work. They've been examining potential regime legal liability for COVID-related casualties in the context of attacks by the regime on healthcare infrastructure. And I will stop there and hand it over to my colleague, CGP Fellow Bassam Barabandi. And go ahead and take it from here, Bassam, please.
Thank you, Faisal. I don't know if Dr. Khaldoun with us or not. Just any hand, Khaldoun, if you are with us. So just to save time, if you start with Munzir, if you can brief us about the situation in Idlib, what's going on there, I leave the floor for you.
Sorry to interrupt. I just want to emphasize this is going to be mostly an Arabic conversation translated to English. So I will remind our guests to speak slowly and give our interpreters a chance to translate accordingly. Thank you. Go ahead, please.
Excuse me, but I will start with English. So I don't think we need that. Thank you very much. Thank you very much to give me this opportunity to explain a little bit about the general situation in Idlib Governorate. The number of population nowadays in Idlib is almost 3 million persons. 65% from those people are IDPs, internal displaced people, from different governorates like Ghouta, Hamas, Daraa, and other bases. And the number of people who live now in camps, in tents, is almost 1 million persons. So we have about 2 million persons are IDPs, half of them live in camps. The number of hospitals in Idlib is about 54 hospitals. And actually, we can imagine for a moment that this is big number, but the reality, we divided the hospital in the past to small hospitals to avoid lose huge amount of equipment and infrastructure and medical staff during the attack of our hospital by regime and Russia. As you know, since April 2019 until now, more than 70 health facilities were attacked by regime and Russia. So we will see that the number of beds in general is limited. The number of ambulance car in Idlib is 93. The number of ward beds is 1,723. So we have almost one ward bed for each 1,562 persons. This number is very limited, even in comparison with crisis area, not with advanced area, because as sphere standard, for example, we must have at least one ward bed for each 1,000 person. If I want to speak now a little bit about the response for Corona, we as Idlib Health Directorate, part of the task force, which started with almost 5 months under the umbrella of health cluster. In our preparedness and response plan, we wrote that we need almost 31 community-based isolation and 6 hospitals, and support the referral system and awareness campaign and other activity. After 5 months, actually, what we have now on the ground, we have almost 40% from our plan implementing now on the ground. We have 75 ward beds and 205 are pending. We have 40 ICU beds are ready and 92 are pending. We have 36 ventilators are ready and 92 are pending. So we have almost 40%. The main challenge actually in this area, the first challenge we face now in this area, and the most difficult one, is the security situation. As I mentioned before, we lost about 70 health facilities since April 2019 until now. So we as health sector in this area, it is very difficult for us actually to respond to the airstrike, to the parabomb. Till now, Russia and regime attack our area in South Idlib, in Jabal al-Zawiya and Ariha and all this area. So it is very difficult to us in this limited resources to respond to this attack, and at the same time to respond to Corona pandemic. We see that even in advanced country like the USA or the UK, they put all the resources available in their countries to respond to the Corona pandemic, and they face it very difficulties. So how we can respond? We lost a lot of our resources. The second challenge actually for us is lack of resources, lack of financial resources, lack of knowledge resources, lack of human resources. The third one is absence the multi-sectorial response. And that due to main 2 reasons. The first one, we don't have central governance in Northwest Syria. We have many bodies. We have, for example, SIG, Syrian Interim Government. We have in Idlib, there is Salvation Government, has some influence in Idlib. We have many local councils. We have a health directorate. We have NGOs. So I can say that we don't have central governance for health.
So central government, what the importance of central government? What do you need it for? Or in other words, today, how you are managing your life day to day?
Yeah, actually, we as Idlib Health Directorate, we manage the health response. But the problem, when we speak about Corona response, we must speak about multi-sectorial response. We must speak about shelter, about people who work in hygiene, for example, and in other, about education, not just about health. So inside Syria, because we don't have central governance, we don't have government like other countries, we don't have multi-sectorial response because each sector work alone. Yeah, and the other issue, we don't have multi-sectorial response even in the level of UN agency. For example, the health sector, the health cluster in Gaziantep has its plan, but the shelter has different plan, and the other sectors, the education sectors has different plan. And this is very huge problem. And how we can see this problem? The most important medical response actually is provide and support people with oxygen, because we know that the 14% from patients in general need support by oxygen and medicine. 80% don't need any medical support, and 6% need ICU beds. And because we don't have enough number of ventilators and medicine, so we have to focus on the 14% from patients who need support with oxygen and medicine to protect them from going to the third category, the ICU beds. In our plan, and to be honest, we are as individuals part of the task force and part of the people who wrote this plan. In our plan, there is no mention to oxygen generators. So now we have huge lack in oxygen in Idlib. And if we want to speak about the non-medical intervention, which is the most important intervention now, more than medical intervention, we don't have, for example, mask for societies, mask in general for societies. And when we did many forecasting studies last time, we see that the non-medical intervention more important than medical intervention. And till now, we don't have, for example, mask for society, because when we started our awareness campaign last time, actually, when we asked people to do social distancing or to wear mask or to stay at their home, the response in general was negative. Most of people told us that you are right, but we don't have money to stay at our house. We have to work daily to get our basic needs like potable water, like food, like other issues. So we can't actually ask people to stay in their homes in Idlib, but at least we must convince them to wear a mask. We finished the survey from almost 10 days with local NGO, and we see at the results that 10% from people in general wear masks now in Idlib, and 25% don't wear masks sometimes, and 65% don't wear masks at all. And when we asked about reasons, 44% from people said that we don't have money to wear mask, and in general there is no mask in market. So the most important intervention at the medical response, at the level of medical response, is oxygen, but it is not available in our plan. And the most important intervention at the level of non-medical intervention is mask for society, and even this item not available in the other plan. So this is very important and critical point from my point of view, that we don't have multi-sectorial response. This is the main idea, and I'm ready to have question if you want. Thank you.
Let's hope Dr. Khaldun, thank you very much. Let's hope Dr. Khaldun is still with us, or he will come back to us. He was with us for a while. So maybe, Rogers, if you can give us a little bit about the research that you did, then I will come back with some kind of questions.
Absolutely. So thanks for inviting me to join today, and thanks to Dr. Munzer for providing some helpful background on the real situation. In talking about criminal accountability, I don't want to detract from the real important issue that we should be discussing, and that is the humanitarian crisis that exists. And certainly that should be the first order of priority, is to ensure that the spread of COVID-19 is mitigated, and that those who become sick are able to receive treatment. That said, this is the COVID-19 pandemic is something that we've been watching closely at SJAC, and something that we were really concerned about because of the conditions on the ground that were really ripe for the spread of the disease. It's no accident that the healthcare facilities and the healthcare infrastructure is not ready to address such a serious disease. And that's because the Syrian government has made a concerted effort to attack healthcare infrastructure throughout the course of the conflict. And that has included direct attacks, intentional attacks against hospitals. A recent report by Physicians for Human Rights estimates that there have been around 600 attacks on hospitals throughout the course of the conflict from March 2011. There have been, in addition to these attacks, the intimidation and persecution of healthcare providers. Those, for example, counterterrorism law number 19, which criminalized the provision of healthcare to opposition fighters, naming them as terrorists. This is just one example of the way in which doctors are intimidated. We're hearing reports from Damascus that those who would report the number of positive cases of COVID-19 would be subject to persecution or prosecution. These kinds of things do not prepare the health sector to address a serious event like the spread of COVID-19. And third, what we've noticed is that the humanitarian aid that is being sent to Syria is being diverted in a discriminatory manner and in ways in which, to punish those in opposition-held areas.
You mean even for during the corona things, or you talk historically?
I'm talking historic. There's been a historic pattern of that, and there's no reason to believe that the government has stopped that kind of conduct. We have specific examples of them stopping aid shipments and removing medical equipment from them. And the closing of these cross-border points, humanitarian aid points, as exacerbating that problem. We saw from Save the Children that the situation in Northeast Syria the health situation is drastically worsened because there is no access to medicine because the aid, the cross-border point from Iraq has been closed. This is due to the UN Security Council being unable to reapprove that cross-border crossing. And there are a number of things that the Syrian government should be doing in order to address the COVID-19 outbreak.
What do you think they should do?
So I think that the very first thing that should be done is to reopen these cross-border points. Merely because UN Security Council cannot agree on it does not mean that the Syrian government shouldn't take its own action spontaneously to permit the UN to provide aid through these points. The second thing is that political detainees should be released. As bad as the situation is in Idlib with close to 3 million persons living there, the inability to socially distance, that problem is even worse in a prison where social distancing is absolutely impossible. Nutrition is very poor. Often detainees are mistreated. You have a lot of problems that are really ripe for the spread, unmitigated spread of COVID-19. So there needs to be a serious effort to release political detainees. So these are a few of the things that need to happen. As Dr. Munzer was saying, there needs to be provision of oxygen and medicine to these areas. And so the international community should make all efforts to provide those things. I know there's a concern that economic sanctions might prevent the government or those in Syria from receiving important aid, but I would note that there are exemptions and exceptions within the sanctions regimes to permit humanitarian aid to flow into the country. There are some bureaucratic details that need to be sorted out, and we have made some proposals for facilitating the use of those exceptions. But humanitarian aid needs to be flowing into Syria.
On humanitarian aid. So when you talk about exception, that means as if there's something is blocked and be waived. My understanding from all sanctions on Syria, it has nothing to do anything with the humanitarian aid. Correct me if I'm wrong, I don't know.
Well, this is not the reason for humanitarian sanctions. The reason is because of the human rights abuses of the Syrian government. That's why the US government and the EU are imposing these sanctions on the government.
My idea that the sanction on the regime, it has to do with the violation of human rights, but the material that sanctioned, it has nothing to do with the humanitarian aid.
Exactly. So it's
fuel for the military aircraft. I mean, this kind of communication, military communication stuff.
That's right. There have been complaints by some Oh, sorry, go ahead.
I mean, when you talk about humanitarian aid, I doubt there's any sanction as such on them.
Well, here we're in agreement that there are no sanctions on those. They specifically, some of the sanctions are written broadly so as to prevent the importation of certain dual-use items that could be used for, chemical weapons, for example, like chlorine gas, but they could have other purposes, or but certainly the regime is the sanctions regimes are very clear, and that humanitarian aid should flow. There is a problem of overcompliance at times. Certain companies are so concerned that they might be subject to these very serious sanctions that they won't engage even on issues that really don't fall within the scope of the sanctions. So I only make that point to say that aid needs to flow, and humanitarian aid needs to be going into these areas. And I guess I would just conclude by saying that if these things are not done, the deaths associated with COVID-19 are attributable in criminal prosecution to the Syrian government.
Yeah, let's see. So I don't think, Dr. Khaldoun, if you are with us, I think you will be very important to add value for this conversation. Dr. Khaldoun? He was with us for a few minutes before. So we're back to you, Dr. Munzer. When we talk about all the needs that you mentioned, that you have few hospitals, you have a few doctors, you need a lot of needs. When you talk about 3 million Syrian IDPs, or 70% of 3 million people are IDPs, the question comes to my mind. I mean, when you live here in the US or other parts, there's a social distancing, there's a lot of awareness for the people, for the kids. And you mentioned that the people there, they cannot stay at home because they need to work every day. So my question, this if we talk about the city, but how can you describe us the IDP camps itself? We always hear that there is something on the Syrian-Turkish border. There's something like 2 million Syrian, I don't know exact number on the borders. I think, as we saw in the pictures, it's overcrowded. I don't know how kind of awareness you can do with these people. And from your perspective, do you think there's really a serious corona spread in that part? Or if it happens, God forbid, how you see the response will be, the reaction to that crisis will happen? I see the numbers is increasing day by day. Maybe the numbers are very limited, but because the testing is very limited as well. So we don't know what the real number are. And here I would ask you what the UN is doing over there, what the international NGOs are doing there. And I mean, even there's no crossing border or limited right now, but as you know, there's so many INGOs already in that Gaziantep, Syria border. So what they are doing, all these people?
Yeah, actually, first of all, when we did our awareness campaign, the response from people in general was negative for many reasons. One of them, for example, they want to work, they don't have money, but actually the people in general, they don't have hope now. They said that we died for many reasons, for chemical attacks due to lack of food, lack of water, due to cold in winter. So Corona just one more reason for death in this area. So there is nothing new why we must take care about Corona. There are many reasons for death in this area, and we face death every day. So we have really problem here.
Really bad feelings. Yeah.
Yes, of course. The situation in camps, some camps actually, the occupancy rate reach for 400%. So you can see that in one tent there is, for example, 12 or 13 or even 15 person. So it is impossible actually to ask those people to do social distancing in any.
35 people in one tent.
Yes, you can. Yes, in some camps, not in all camps, but in some camps, because you know that most of camps actually in North Idlib is not regular camps. There are some regular camps, but there are some people actually they don't have any support from NGOs or others. Just they put some tent in lands and live together. And if we remember that in the last military campaign, when the number of IDPs increased with almost 1.2 million people on the Turkish-Syrian border, the percentage of people stay in camps was approximately 25%, while 75% they don't have places in regular camps. So some of them actually go to the old governmental building or to do some tents in some places. So you can see actually in these places that more than 15%, for example, in one room or in one tent. There is a huge lack in potable water. So actually, when we started speak with people about, for example, you must wash your hands for 20 seconds. The answer was we don't have water to drink. So how you can ask us to wash our hands for 20 seconds? So even the simple issue in the world, we don't have the basic needs actually for those people. So yes, the number of tests very limited. We just received almost 5,000 tests for Northwest Syria. Yes, for Idlib and for North Aleppo, not just for Idlib. The total population in this area, the total number is approximately 4.2 million. So the number of tests we do per day is approximately less than 100 tests. We don't do tests. Yes, that is. We don't do tests for all people.
Say we have 40 or 50 cases of corona is based of 100 tests every day.
Yes, and actually we till now we have just one laboratory in Idlib city. There there is no other laboratory now in Aleppo, but in the plan there are laboratories in the plan actually, but on the ground till now we have just one laboratory. So I agree with you that the real number more than what we have as laboratory till this moment.
So that will the question I mentioned. In Gaziantep, there's, I don't know, maybe hundreds of international NGOs getting a lot of money from all over the world. This is separate from the UN. They are under the umbrella of the UN.
Yeah.
So what this organization are doing to help you and help other Syrians inside Syria?
Yeah, actually, I mentioned
from the numbers you mentioned, it looks like to me they are doing nothing or nothing much.
Actually, this is the reality. Yes, they do some efforts to support the health sector in this area, but it is very limited in comparison with the number of people. And if we look to the situation, the very difficult circumstances in this area, and actually, I guess there is a problem related to the coordination mechanism. It is very real problem.
Story.
Yes, because actually the sounds of Syrian NGO, of local NGO, from my point of view till now, it is not very respected sound in the mechanism of UN work in general. So when we spoke many times about the importance of mask, for example, or about the importance of oxygen generator, because we understand our situation. Maybe it is not very important in some countries, but actually in our situation, we know the reality. We know that impossible to ask people to social distancing. We will ask them, but in reality, we will not reach to anything. So we understand our situation more than, with full respect for actually, more than any expert came from different contexts. So I guess here we have problem in coordination mechanism. We must hear more to the local sounds, to the people, to the local NGO. I guess here we have a problem, and there is a problem regardless of our situation in the mechanism work, in the work of UN agency in general. They don't coordinate with each other. So I guess it is not because we don't have government. If we have government in Syria, like other countries, the government will lead multi-sectorial response. But in our situation, because at least in Northwest Syria, we don't have real government, UN have more responsibility to do that, UN agency in general. But there is no, there is not some coordinate between them, but there is no real coordinate. There is no multi-sectorial response. So for example, now we as health sector, we say that we want to disappoint the opening of schools next month. Yeah, we suggest that. But for example, education sector work alone, and maybe they will take another decision. And we advise the people in camps, for example, to have something to isolate the weakness people, or to isolate some people with symptoms, because we don't have capacity to make tests for all people. But the shelter sector work alone, and they not respond to our advice. So this is the responsibility of UN, I guess, in our situation, because we don't have government.
Some people say now it's Turkish problem now, since they have forces on the ground, they are controlling the borders, they give you all the INGO residency and facilities to work from Gaziantep to Syria, and the absence of any central government or even municipality government. Maybe the Turkish, should control these efforts in order to avoid having disaster or crisis in North Syria, which ultimately goes to them. Some people say like this. What do you think about it?
Yes, I guess you know that there are two different areas in northwest Syria, Idlib and North Aleppo. North Aleppo and Afrin refugee area under the control of Turkish authorities more than Idlib. So in North Aleppo, there is more interfere from Turkish authorities and more lead to the response, to the central response in North Aleppo. While in Idlib, the intervention of Turkish government till now at the level of military and security intervention, not at the level of service. So there is no interfere for health for Turkish government in Idlib at the level of service. So it is not work actually at all in this moment to say that this is the responsibility of Turkish government, because till now they don't interfere in Idlib at the level of service. So what we have now, we have our local institutions, we have NGOs, we have UN agency. We have to find way to work together and to improve our coordination and our platform to work together to respond to corona pandemic. Otherwise, actually, we will see that a huge number of people will die in Idlib without to be able to do anything, actually, without to be able to help them in reality.
So we're back to you, Roger. So according to this, legally, who's in charge of this?
Well, it sounds like there's a lot of overlapping jurisdictions going on here. The only point I've made in my research, along with my colleague, Leila Abifallah, is that because there's been a concerted attack against the healthcare overall, it has deprived the Syrian people of the possibility of obtaining some kind of treatment for COVID-19 and for there to be an effective response to the pandemic. And that therefore it was foreseeable that there would be excess deaths or extraordinary numbers of deaths from the inability of folks to access healthcare. I know we've been talking a lot about Idlib. The situation in government-held areas is slightly different, but we would have to examine whether or not the government is engaging in the same course of conduct. I mean, we can look in Aleppo, and Aleppo certainly was the victim of significant governmental bombings as well, and that would include hospitals. The healthcare workers would be also subject to threats and persecution. But we would have to look at the situation of diversion of aid and whether or not those together, coupled with the intent of the government, would be sufficient to constitute criminal responsibility.
The regime. You are
Mhm.
blaming the regime from day one.
Yeah.
My question, as Dr. Mulder said, that in Idlib, for example, and it is just a small model, it's not a big model, but it's a model of Syria, that it has something like Idlib at North Aleppo, it has around 4 million
Right.
civilian. The UN, with all its agencies and with all international NGOs,
Hmm.
were only able to provide them with 100 tests a day.
Right.
One small laboratory to cover 4 million people.
Right.
Are they responsible legally for the death of this Syrian if something happens? And again, if you talk to Jazeera region, there's Zur, Raqqa, and Hasaka.
Hmm.
My understanding, it had the same problem. We have another 3 million Syrian over there. There's very limited number of testing materials and laboratory. I know the regime is blocking a lot of things to come to them, but they are there. I mean, they are in Gaziantep. They are in part of Idlib.
Sure.
So blaming the regime, it's easy thing, and this common sense for everybody. There's no doubt about it. But the question is, where is the UN or the INGOs, international community, to support the people with masks, for example, the cheapest thing in the world, the mask, or to provide the people with the test? So is there legal responsibility for the actors, other actors, other than only the regime?
Well, I mean, there's an incredibly stark contrast between the actions of the Syrian government and INGOs and the UN. On the one hand, the government is actively attacking healthcare infrastructure, whereas the UN and INGOs are actively working to help people and to provide them with healthcare and humanitarian aid insofar as is possible. And as you say, the government is blocking much of that aid. So I don't think, as a matter of criminal responsibility, you could really
It's about responsibility.
Well, yeah, okay. So, I mean, you might talk about it from a moral responsibility, and I think all of us as an international community have a moral responsibility to ensure that people are not dying needlessly, and that we need to make great efforts to ensure that humanitarian aid is provided in situations of need. And that needs to be facilitated as well. So, I would not deny that. I mean, we've talked a lot about the situation in Idlib. I think we need to highlight for a moment the situation in Damascus, where it seems that COVID-19 is really out of control. And one of the big problems there, I think the current biggest problem, is that the government is hiding the situation. Perhaps it's doing that in order to prevent panic. Perhaps it's doing that in order to save its reputation. Whatever the reasons, it needs to acknowledge the gravity of the situation so that it can start to be dealt with. And as you can see, I linked our recent article that we just posted a few minutes ago that outlines a series of interviews that we conducted with folks in Damascus. And
can you tell us more about it?
About the situation there. What we're hearing is that the hospitals are severely overwhelmed. There's an inability for people to have hospital beds. There seems to be a discrimination in that only high-level officials and those who are connected are able to secure treatment. For those who want to receive tests, it's costing $100 in order to the equivalent of $100 in order to receive a test for COVID-19. We saw a scene this morning where there was a huge line of folks trying to get a test. All of these people are not socially distanced, and I understand it. The situation broke down in sort of skirmishes because there was such chaos. So I think people are justifiably really fearful in Damascus. And that's because, you know, they don't trust their government. Their government is not being truthful with them. And, you know, the first step to remediating or, you know, fixing that problem is for the government to come clean, to be honest about the gravity of the situation, and to, you know, seek assistance elsewhere if they need it.
So Dr. Munzer, I will back to you with the same thing. You are expert in Idlib, but now you are a doctor and you are Syrian. When we see what's going on in Damascus, that when you read on the Facebook and Twitter and other social media, that every day in each neighborhood, you have tens of people who are dying from corona everywhere in Damascus in a way or other. So you as a doctor, how you read it? Yani we understand Idlib situation, that's fine. What about Idlib? You as a doctor, when you are watching what's going on, definitely you have many friends who were with you with the university and others who can maybe tell you what's going on. So can you hear from you your analysis of what's going on in Damascus and other parts of Syria and under regime control area?
Actually, yes, I have a lot of friends in Damascus and in different areas under the control of regime. And I spoke with them from the beginning of this crisis. First of all, they told us at the beginning that the regime don't allow to them to speak anything about corona. So there were a lot of cases of corona before the regime to publish anything. When the regime was said that we don't have corona, there were at that time actually a lot of cases. According to my colleagues, the doctors who work in different hospitals in Aleppo and Damascus and other area. Till now, actually, they face the same problem. A lot of people die in hospitals, but in documents they don't write it because corona, but they can write any other reasons. And actually, the most important thing that the people in general don't trust in government at all. So this part of the problem, because even some people die for other reasons, but because the government don't say anything correct, maybe some people think that those people died because corona, but maybe the reality there are other problems. So the people actually in general don't understand what happened. A lot of people die every day, everywhere, and nobody explained to people about the real situation. The hospitals in general full, 100%, and many people actually pay a lot of money.
Or full of other diseases.
No, I guess now a lot of those people have corona. Maybe before.
Yeah. Just to say, so WHO headquarters is in Damascus.
Yeah.
And last year, I think they had the budget around $100 million.
More than 100 million, yes.
Let's assume $100 million. When we say that $100 million for the health sector in Damascus, I don't know if this $100 million is for Syria or is for the regime control area.
For the regime control area, I know this plan, yeah.
So how they spend this money? How they spend
yes,
this?
We know the situation in Syria, actually. We know that...
the corruption. Let's say 50% corrupted, we leave another $50 million. So $50 million, when we talk about Mustashfa al-Faransi or Muasad and Nafis and 5-6 big hospitals in Damascus, يعني it's $50 million, it's enough if they corrupted, if they steal 50% of the money. Still the other 50, it should be enough for at least providing the test for everyone, almost.
Yeah, actually, the situation is catastrophe. I guess even the situation in Idlib very bad, and we lost a lot of our health facility. But as I see it till now, the situation in Idlib better than Damascus and better than till now it is better from my point of view.
So
at least, yeah, we tell people actually frankly about everything. We tell people about our capacity and about our weakness and about number and about our problems. And actually, even you know that even in most of crisis areas, there are some corruption. maybe in any crisis period, but I don't think that there is any other place has the same level of corruption like regime area, because nobody can say anything in that area. Yeah.
يعني today I heard that المستشفى الفرنسي the neighborhood of Christian neighborhood in Damascus, they said يعني as if the regime want to kill all the Christian out. The number of people that the hospital itself has been closed. So many doctors, nurses, that hospital, they are dying.
Do you know now that the people in general, they don't have medicine, even cetamol. Many of people actually called me last time that we don't have in pharmacy even the cetamol, paracetamol. They don't have actually even the very simple medicines in market. The price is very high in comparison with the income of people, and actually they don't have. So some people actually asked us actually last time if we can send some medicine or like this to the regime area, but actually unfortunately there is no way, because there is no.
How you explain the shortage of medicine in the regime control area?
Yes, because actually the price of medicines till now it is very high for the income of people. So the people don't have money to buy medicines. A lot of factories last time stopped their work because they can't actually work in this circumstances. And actually, as you know, many factories in North Aleppo, in between Aleppo and Idlib, were attacked by regime last time. So now we have very critical problem actually in offer the medicine, even in our area. But actually, in our at least till now, the border is open, and we have
how much the consumption of this medicine in Idlib by dollars?
About 10%. We did a survey.
How much you pay per year the consumption of this basic medicine in the northern, in the Idlib and northern Aleppo?
Actually, we
dollars.
Yeah, we about money. You mean?
Yeah, about masari.
I guess maybe about $10 million per year. Yeah, I guess about that, because actually when we did survey last time, we discovered that almost maybe like 9% from all medicine in the market coming from donors and NGO, and about 91% coming from private sector in Idlib. This survey was.
So Roger, we're back to the legal issue of importing, exporting the medicine. As your legal consultant and your law, you know that all the US sanction and the EU sanction on Syria doesn't include the medicine. So where the problem from you see it? Why we have this problem, you think?
Well, as I kind of mentioned before, over-compliance by a certain number of companies is an issue. There are those that would like to do business, but it's really not, with Syria, but that there is really not worth it for them to enter into this risk that they would be subject to sanctions for this small amount of business, or relatively small amount of business that they could engage in. I think of something so frivolous as an Arabic language learning app, and seeing that those within Syria are being blocked from using it as an example of a situation where clearly a learning app, Duolingo, shouldn't be subject to sanction, but because the company doesn't see any benefit by potentially violating a sanction, or not going through the legal analysis and seeking legal opinion about whether or not that would violate a sanction, they over comply. And
when I ask this, I'm trying to say, indirect way, is it the WHO and other UN agencies? They can be the bridge between the market, international market, and Syrian market, official market through the, you don't have the American company to sell the Syrian government. The WHO or the UN, they come buy these materials from the international market, which they are doing anyway in many parts of the world, and they just give it to the local distributors or whatever relation with the Syrian regime inside.
mm-hmm.
And I talk about very basic, like cetamol, like Panadol, like the basic things. I'm not talking about dual-use materials.
Right.
I
mean,
do you think this is thing the UN or the WHO can do? Because there's big question mark about what WHO is doing in Damascus.
right.
As a money, they have more than $100 million. And the cases, the things is going in the regime control area is terrible. So they don't mention anything. They don't mention any reports, but they spend the money, how they spend the money. And the regime and his broader regime, they claim that this is because of the sanctions. And for me, I'm just outsider. I'm not legal expert. I'm not medical expert. I can see many cases in the world where the UN brought, like Ebola in Africa, it was the UN response. They get the medicine and they send it everywhere, for example.
Mm-hmm.
So do you think legally, from your perspective or from your knowledge, this can help the people to save lives? Is this the UN role?
Well, this is kind of out of my area of expertise. I would say that there is a concern about transparency of what's going on and how the WHO is working with the Syrian government. So I think they need to be a bit more clear. I don't know where you get this number that they have $100 million in a bank account, but
I think it was their budget last year.
For the entire, okay. So the WHO worldwide, you're saying?
No, in Syria.
In Syria, okay. So if they indeed do have access to these funds, then of course they should be provided impartially and throughout Syria to those areas in need. But the Syrian government historically has not allowed that to happen. The closure of these cross-border points is a significant concern. And so, yeah, those issues need to be addressed. But, in principle, I don't see an issue with the WHO purchasing paracetamol and providing it to the population in need.
Again, I hope Dr. Khaldoun join us. He's around, but for some reason he's not able to join us. Unfortunately, we have to conclude here. We missed two partners or the panels, one from Deir Zor and Khaldoun from Damascus. I hope we can provide you more information about the situation in Corona, but I think there's a big massacres is going on in Syria using the Corona with silence of the media and the regime controlled area. And we try in this small panel just to raise awareness what's going on in Syria. And thank you very much, Dr. Munzer. Thank you, Roger, for joining us in a very short time. Always we thank Rasha. She is our spiritual guide, and CPG for hosting us all. Thank you very much for all who was listening to us.
Thanks very much.
Thank you.